Welcome to our presentation on the systems of New Century Health Clinic. My name is Tim Higgins and my partners are Kellsey Stant and Matthew Preller. During our presentation today, we're going to go over the background of the current system, problems with the current system, benefits of a new system, the system requirements, and an analysis of potential solutions. The background of the current system. So what you see on your screen now is a context diagram that shows the patient record system and the entities attached to it and the processes that go about it and the inflows and outflows from that process. This is a level 0 data flow diagram which shows the record database process and the inputs and outputs from various entities and activities that happen within that process. This diagram here is an entity relationship diagram which shows the various entities involved in the processes for New Century Health Clinic with their unique characteristics and their connections to other entities. So the problem system are that you're having difficulties with your records. The creation of an appointment list is difficult. You have multiple employees handling your paperwork. Their monthly mailings aren't getting out on time. The claims status report is getting messed up and is incorrect based on the processes within the system, and the weekly meeting notes are having to be input by hand.
Here are your benefits of a potential new system. The tangible benefits include a better organized file and system, easier access to data, and more accurate files. Your intangible benefits would include improved employee satisfaction. Your employees' time will be used more effectively, and it leaves less room for errors to be made. The system requirements would be: for your outputs, your claim status summary should be produced by the system automatically. Employees should be notified of any changes in appointment times and dates. Reports are generated by the system when they are needed. Patient invoices and bills should be kept up to date and prepared to be sent out. Your claim status reports should be sent to all insurance companies, and a call list should be generated for the following day. The system inputs are: the employees would input the data about the patient information, visits, and history. The patient's insurance information should be entered. The employee should set up invoices for the patient's visit. Data entry forms must be all user-friendly. And after the appointment, the patient's history should be updated. The system's processes: after data is entered into the system, reports should be generated automatically. A notification should be sent when the report is finished and ready for the next user. The system should send out the patient's bill, and the system should send the claims status summary report to insurance companies. The system's performances: entering data into the system will help to ensure accuracy. The system must make tasks easier for employees to complete their jobs. The system must store data about appointments and patients. It must make employees' duties less time-consuming. And the data reports and patient documents must be searchable and easy to find. And the system controls include: the employees will have a username and password to log on to the system. The patients should all be identified using their last names and their social security numbers, and there must be a way to ensure that there are no duplicate entries.
Our analysis of potential solutions. Developing this software in-house is displayed on the chart below. It shows costs, benefits, and your break-even point, which developing in-house is $25,521. Through the Clear Data system, your break-even point comes to $19,321. And through the vertical software package, your break-even point is again $19,321. Our recommended solution is to choose the vertical software package because it is least expensive, improves performance, and is a more integrated system. Here is an example of what your user interface might look like. And here is an example of what a summary report might look like.